Glasses or contact lenses. Seeing aids to correct near and far-sightedness are taken so much for granted that those affected hardly think about them anymore, even when these aids create other troubles. Glasses that fog up when the temperature changes. Headaches caused by the weight of the glasses. Contact lens wearers who suffer from tiredness or pressure on the eyes or dry eyes. Often, these difficulties are simply accepted as unavoidable inconveniences. But the desire to get by without seeing aids is always there.
I do lots of sports, go skiing or to the sauna. It's not very practical with glasses or contacts, going in and out of rooms, because they fog up. And I didn't like the way I looked in glasses. So I used contacts and they dried my eyes out.
I have problems with contacts when working at the computer screen. I also feel the contacts at night.
I couldn't always wear my contacts comfortably. Only for a couple of hours. It was a hassle carrying the cleaning solutions, the glasses and the lenses around. My eyes got tired, dried out and became irritated.
I pretty much did it for vanity reasons. I didn't want to have to decide every morning which glasses to wear or whether to wear contacts.
My motivation was increasing nearsightedness. I considered getting contacts, but at my age, I didn't want to bother with it.
Life without seeing aids is now possible with Lasik, the laser-supported operation. Lasik is a procedure which has been implemented since 1990. In 1999, the method was recognized by the German Ophthalmological Society and the Professional Association of German Eye Doctors as a scientifically valid method for healing different forms of near and far-sightedness. The visible part of the human eye represents only a small part of the entire eye. This visible part comprises the white conjunctiva and the clear transparent cornea in its middle. Through the cornea, the colored iris can be seen with the black pupil in its center. Behind these, the lens of the eye is located. It is located in the first third of the eye and is surrounded by a fine layer of skin, the lens capsule. The vitreous cavity, located behind the capsule, represents the largest part of the human eye and contains the clear vitreous body of the eye. The largest part of the refraction takes place via the cornea. The lens is only responsible for the fine-tuning of the image. In people with normal sight, the spaces between these individual elements, cornea, lens, and retina, are coordinated in such a way that a focused image is created, regardless of its distance from the eye. In nearsighted patients, the light rays are bundled by the retina. The refractive power of the cornea is too strong. In farsighted patients, the light rays are bundled behind the retina. The refractive power of the cornea is too weak. A correction of these conditions is possible for nearsighted patients up to -10 diopter, in farsighted patients up to +6, and in patients with corneal curvatures. The patients should be older than 20, and their eyes should be stable for at least 1 year. The eyes are carefully examined before the operation. The quality of the entire optical system is thoroughly tested. First, the optimal visual acuity and the dioptric values are determined using the fluorooptometer. Then the cornea and retina are examined using a slit lamp. The corneal thickness is established with a pachymeter, an ultrasonic device, and the corneal topography is measured with the so-called orb scan. Any existing visual distortions can be discovered with the aberrometer. All these data will be needed later for the operation. They will determine the way in which the laser works the cornea, similar to an autopilot in an aircraft. The operation is performed on an outpatient basis. The patient is led into the operating room by an assistant who will also be present during the procedure. First, the eye is anesthetized with drops. This way, the patient can't feel anything but can still see. When the patient is finally lying on the operating table, he or she concentrates on a fixed point of light so that the pupil remains as still as possible. First, the operator places a suction ring on the eye in order to further stabilize it. During the operation, the eye is additionally controlled with an eye tracking system. The computer-controlled blade of a corneal plane separates a 1/16 of a millimeter thick corneal lamella, which is still connected by a thin lap. This lamella is then peeled back like a lid. Now the operator can begin work with the excimer laser. The bundled cold light ray concentrates so much energy on a single point that it evaporates all tissue there without heating and damaging the remainder of the cornea. Up to 200 laser impulses are fired per second, and a new corneal topography is created according to the data obtained by the measurements carried out earlier. In nearsighted patients, the cornea is flattened. In farsighted patients, it is lasered up to a more acute angle. The corneal lamella is then folded down and pressed slightly. No stitching. Because of the form of the cornea, the lamella attaches itself automatically. The operation requires only minutes. The eye is then treated with antibiotics and the patient can return to the waiting room.
Die Operation war erstens mal sehr, sehr schnell. Es hat insgesamt 5 Minuten
The operation was very quick. It took only 5 minutes. The clinic personnel was very friendly and explained everything in advance. It wasn't entirely pleasant, but no worse than going to the dentist.
Für mich so Schmerzklasse Zahnarzt ungefähr gewesen. Habe auch keine Angst gehabt.
I wasn't afraid at all. I was optimistic when I went in. You have to have some trust.
Man muss nur Vertrauen haben, das ist alles. Vertrauen. Und das hatte ich.
Ja, ich habe mich einfach auf diese
I just laid down on the table and that was it. You just need to relax, though you do feel a bit helpless. But it wasn't bad at all.
Aber es ist nichts Schlimmes.
Patients notice quickly that they can see normally again. A little blurry at first, but then perfectly normal in very little time, and much better than before.
Afterwards, I just went straight home. It burned a little bit that night, but then the next morning I noticed I could see better than I ever did with glasses.
Ich konnte eigentlich sofort was sehen.
I was able to see immediately afterwards. I got protective bandages. I wasn't allowed to remove them because my eyes were still irritated. But I was able to see in focus through the little holes.
During the first days and weeks following the Lasik operation, you can see normally, but you should be cautious.
It's a technical wonder. I can wake up in the morning and see the alarm clock. Amazing.
Ja, toll, weil es sind natürlich so Dinge wie jetzt,
It's great. I can take extended trips, adventure vacations, sleep outdoors, everything. Before, I couldn't do those things for hygienic reasons.
weil da ja dann doch immer gewisse Hygienesachen doch eingehalten werden müssen.
Ja, wie ein neuer Mensch im Prinzip.
It's like being born again. It's a great feeling not to have to run into the bathroom first thing in the morning to put in my contacts or grope around for my glasses.
Die Brille suchen muss. Also es ist einfach toll. Ich bin froh.
I feel great. It's been 8 months and my vision is completely normal. You get used to nice things in a hurry.
Angenehme Dinge gewöhnt man sich schnell.